Gary Nickerson.
And I'm Quinn Taggart.
And this is Outside My Window. And our guest this evening is Dr. Robert Strang. Now, in case you've been living under a rock for the last couple of years.
Several rocks.
Several rocks. Dr. Strang is the Chief Medical Officer of Health in Nova Scotia, and he was appointed in August of 2007. He received his medical degree from the University of British Columbia and completed his family practice and community medicine residencies at UBC. He moved to Halifax in 1999 to become the Medical Officer of Health for the Capital District Health Authority. As CMOH, he has provided leadership around the renewal of the public health system here in Nova Scotia, as well as raising awareness around the importance of creating policies and environments that support better health for families and communities in Nova Scotia. He is very passionate about public health and has worked with non-government organizations such as Smoke-Free Nova Scotia, Heart and Stroke Foundation, and Public Health Association of Nova Scotia. Dr. Strang has an adjunct appointment with Dalhousie University Department of Community Health and Epidemiology. Dr. Strang, welcome to the podcast.
Thank you both. Thank you for the opportunity.
Let me ask you, first of all, give us a sense of the roles and responsibilities that you have as Chief Medical Officer of Health for the province.
So, it's been prior to COVID, my responsibility was, broad. It touched all aspects of public health from the day-to-day stuff we always do in my medical officer of health team around communicable diseases, environmental health issues, but always still involved in longer-term issues around that create healthy environments, whether it's tobacco control. Prior to COVID, I was just spending a fair bit of time working on our serious issue here in Nova Scotia and across the country around the use of illicit drugs and overdose. Getting even as broadly as what we call in public health the determinants of health, those kind of structural things that allow individuals, families, and communities to be more or less healthy. Things like affordable housing, poverty, a range of things. So, in general, public health touches a lot of things. So my work would touch a lot of things, and much of it was trying to work with other groups in other government departments, working across or other groups and communities to try to, all the things I've talked about are by and large big complex issues that you move slowly forward. Once COVID hit, everything's been very much focused on COVID, and all the other stuff is, to a large extent, has had to be kind of put to the side. My colleagues here in the department as well as in that health authority, public health, and as we start to slowly come out of COVID, then we're starting to think about, well, how do we pick up some of this other work? Maybe we'll get into it a little bit later. I think there's a lot of things we can learn from COVID, some of the underlying factors and lessons learned that we're making sure we hang on to those as we start to move into a phase from dealing with the pandemic to what we call living, more longer-term living with COVID.
So have you had to delegate any of that stuff out, or is it all hands on deck for COVID?
I think it's been all hands on deck pretty much, as we've been able to do. But there are some things that we've worked on, putting a COVID lens on it. So, no surprise to most people to hear that one of the key issues that we hear over and over again, that is a fundamental factor on whether people can be healthy or not, is affordable housing. Do people have a safe home? And we know that in COVID, we actually had to move our work around affordable housing and people who were homeless. Typically we've been focused on shelters, but because of COVID, those were places that weren't safe from a COVID perspective. So we worked across a number of other government departments, and we had, certainly during Wave 1 and Wave 2, and we're still using it to some extent, during Wave 3, that using a different model of actually using a hotel-type model. We had many hotels that were empty, and so we were able to use those as temporary housing for people, to whether they were identified as a COVID case or there had been a contact, or just in general to keep them safer so they wouldn't be exposed. And so, I use as an example of thinking differently, that maybe we need to think differently about how we support people who are homeless, which is a long-standing issue for public health, and the shelter model may not actually be the best way we do that. So so we had to do things for COVID that maybe we need to think about. There were some value in those that we need to talk within government with communities around, is perhaps using that more as a model rather than a shelter model. So again, that's just an example of how the COVID response may have some long-term implications for our longer-term work.
Dr. Strang, you know better than anyone when it comes to all this misinformation, even some conspiracy theories out there on vaccines, as an example. What would you wish people to understand about the science behind it all?
So, there's no doubt this is rapidly evolving, and this is a new strain of coronavirus, the SARS-CoV-2. The specific virus that causes COVID. So there's lots we didn't know at the beginning, although we knew a fair bit based on we knew it was a coronavirus. But there's a lot of things that we know now about how this disease is transmitted, who's most at risk, what are the situations that put people at risk, that we responded differently in wave 2 and 3 than we did in wave 1. But there's lots we still don't know about what is the long term. As I said earlier, kind of living with COVID. Is this virus going to be around for the long term? Will we need to have periodic booster doses with like we do for flu? We don't know that. It may be that we didn't have any influenza at all in Nova Scotia this last winter. Very little across the country, and in other countries they had very little. Now, is that just because all the things we put in place to control the spread of COVID, like the lockdowns when necessary, social distancing, keeping people in small groups, masking, hand washing? That may be, but there's also some people are talking that maybe this new strain, the SARS-CoV-2, maybe it might replace influenza. So we may end up not having as much influenza around in years to come. I use that as an example that those are questions that we need more science and research on. So there's a lot we still have to learn. And I think the key message for people is that we work very hard. I have twice weekly calls with my colleagues across the country. The Public Health Agency of Canada stays on top of the science, and then we learn from them in these calls and in other mechanisms. So public health work has been working really hard for the last year and a half to stay on top of the evolving science. But just because we change what we're doing as we learn doesn't mean what we did initially was wrong. It's just we've learned more, so we have to adapt to things. The other question I get a lot is about the vaccine. Well, is that how can we have produced a vaccine so fast? Because it went so fast, does that mean it hasn't gone through the same kind of safety steps? And the answer to that is it has moved fast, but absolutely the COVID vaccines have gone through exactly the same process that any other vaccine goes through. The technology to produce the mRNA vaccine has been worked for years. This is the first time we're using it to actually produce a vaccine that's used. But the reason we've been able to move so fast and the science moved so fast is simply because there was a focused global effort with significant financial resources brought to bear. And as the science was evolving, all the clinical trials that start with testing on animals and then smaller and then larger groups of humans, what we call the different the clinical trial phases. The COVID vaccines went through all of those, like any other vaccine, any other pharmaceutical product. It just we were able to do it because of the sole focus. It went faster. And then the approval, the regulatory approval. So in Canada, it's Health Canada. Other countries have other regulatory bodies that look at both the data on the safety and effectiveness of these vaccines. Usually they wait until all that data is there and then they do an approval. because of the needs, because we're in a pandemic and the need to approve the vaccines as quickly as possible while adhering to the appropriate level of evidence, there were what we call a rolling approval. So as new data developed, the companies would then bring it in and add it to give it to Health Canada. So Health Canada was able to speed up their process because they were getting information, looking at it, making an assessment, and then waiting for the next bit of information. And then ultimately, the same standard of evidence on safety and effectiveness was applied to these vaccines that were licensed in Canada as any other vaccine product. So we know that the same steps have been taken, the scientific and regulatory approval steps have been taken for these vaccines as any other vaccine. So we are following the science. As the science evolves, we adapt our approach based on the new learnings, and certainly the science and the regulatory approach has been maintained for these vaccines.
Dr. Strang, can you explain to us, and please dumb it down for me, if you would, the variants? We've got the Delta variant. I've read about Gamma variants. How does that all play? How does that come to be from the original COVID?
Well, and people, I'll go back to, I'll start my answer with people think about flu every year and why we need to produce a flu vaccine. And I've always talked about every year the flu virus changes and it creates a new cousin. So each of the flu strains are like a cousin of the previous strain. And sometimes it's a very close cousin and the vaccine works well, and sometimes it's a more distant cousin, and then you have to produce a new vaccine. The same thing is happening with this, and it happens with every virus, but the same thing is happening with the COVID virus. It is creating new strains, and it's, viruses do that. They adapt genetically, and it's creating new strains. Some of those strains are really no different, and the ones we're most interested in, and people may have heard the term variant of concern, it's when there is a new variant. There's a lot more new variants out there, but we only focus on the variants of concern because as we detect the new variants, we get evidence that maybe they're significantly more infectious, they're able to spread much more easily, and or they cause much more severe disease. So we had, they've changed the name now, and rather than naming them by country, which I think is a good idea because you don't want to label and stigmatize countries. The first variant of concern was the Alpha variant, and that came around, early in 2021, and it was much more infectious. It could spread more easily, and that contributed in a small way in Nova Scotia to some of our spread. Fortunately, we didn't have much introduction of that, but it has become the main variant, the main strain of COVID virus now in Canada is that Alpha variant. And that was the one that originally came from the people, we called it the UK variant. The most recent one now is we've had two others. The most recent one is what's called the Delta variant. And and it is even more infectious, so more easy to spread even than the Alpha variant. So things that would not necessarily have caused the virus to spread from one person to the other in wave 1 or even in wave 2, they absolutely allow the virus to spread for wave 3. And that's why we saw here in Nova Scotia, like other provinces, a significant surge of virus in wave 3, simply because the Alpha, well, it was mostly the Alpha variant, and then some of the Delta variant were here in Nova Scotia, much more easy to spread. The other concern now around the Delta variant is the emerging evidence that it takes 2 doses of vaccine to get really good protection against the Delta variant. 1 dose of vaccine, it provides good protection against the other variants and the original virus. We still need 2 doses of vaccine to get the best protection. But for the Delta variant, 1 dose of vaccine does not only provide at best, modest, about 30 to maybe 40% protection. Whereas the other variants, it's 70 to 80% protection with a single dose. So that is why we remain very cautious and careful, because there's a growing, more and more across the country, a greater percentage of the virus that's there is now this Delta variant. And we have to be careful about how many people and under what circumstances we let come into Nova Scotia, because they're potentially bringing that Delta variant. And we're just now starting to get second doses of vaccine into people. So we need to remain, this is my key position around the Delta variant, we have to be cautious about opening our borders until we get a much greater percentage of people in Nova Scotia with that 2-dose protection. And then once we get there, and the minimum number we're aiming for is having a minimum of 75% of the total population with 2 doses of vaccine. We're on target to have that kind of towards the end of August. If all the supply we're promised comes, and we still get lots of Nova Scotians getting vaccinated. That means we still have to be careful at our borders about how people come in, and we still have to have things like masking indoors, keeping groups of people small, physical distancing, because those are important, because even if the virus gets here, all those steps help slow down and prevent the spread of the Delta variant and any other variant. But we have to, because of the ability for it to be spread quickly, the Delta variant, and especially with people only 1 dose of vaccine, that's why we continue to remain very careful at our borders and how people come in. And I hold a very firm position that we can't move away from a 14-day quarantine for people who are unvaccinated, and we still need the 7-day quarantine for people with 1 dose of vaccine, at least throughout July, as we build the 2-dose protection amongst Nova Scotians.
With the variants, Dr. Strang, are we any closer to having an instant test to be able to detect variants up front rather than having to wait that extra time and send the samples away?
We're working on that. I mean, we do have some screening which identifies the previous, the alpha, the beta, and the gamma variant. I believe the third one's called. We don't have very much of the beta and gamma. But we don't yet have the screening test for the Delta variant here at the lab. We are working on, with the national lab, we're working to get some things in place that we could actually do all of the variant testing here at our lab in Halifax, rather than sending them off to the national lab in Winnipeg, which has most provinces are sending their specimens there, and as you can imagine, that lab has a lot of pressure with all the specimens. I'm not a lab expert, but it takes very specialized pieces of equipment, etc., and then training to get that stood up. But we are working to build that capacity right here in Halifax.
And to me, I mean, as a layperson, that seems to make the most sense. I mean, controlling the border is one thing, but being able to test people as they arrive and be fairly confident that if they have that variant on them, that we're able to pick that up right away.
Well, 2 things on it. We're now testing people at the airport with a rapid, or not a rapid, but we're actually using PCR tests that they're swabbed right at the airport, or if it's late at night, they get a take-home test, and then they have to go take the test themselves and swab themselves and drop it off. And we continue at the border to make sure we direct people coming in to the appropriate place to get a test very early on their arrival. That's important, because if they're infectious coming in, then we want to pick them up. But we also have to remember that the tests we have only tell whether you actually are positive or negative for the virus. They don't tell you what variant strain you have. That's why we have to develop this second line. So if somebody's positive, then we do a second set of tests to help us tell what variant they may have. There's no rapid test that will tell you in a short period of time that yes, you have the Delta or the Alpha variant. But we're now going under the assumption that certainly pretty well every case we have is a variant case, and most likely here in Nova Scotia, it's the Alpha variant. And so that means that there's a much greater chance if somebody's infected, they're spreading it to somebody else. Again, why we need to continue to hold on to many of what we call the public health measures, masking and the other things that I mentioned previously. Lots of other places are opening much faster, and they're not doing as well as their vaccine coverage rates. So I think they're setting themselves up, and there's been a lot written about the U.S., which is wide open. All you have to do is look at crowds in the Stanley Cup playoffs, in the Canadian crowds versus U.S. crowds. But if you understand that many of those jurisdictions in the U.S. have quite low vaccine uptake rates, they potentially faced a huge resurgence of the Delta variant if and when it gets introduced and starts spreading widely in the U.S. So again, they're taking on a much higher level of risk, and I have to mention that because a lot of people say, well, how come we have to still be so closed down here? Our cautious approach has stood us well for the last 16 plus months, both in terms of minimizing the impacts of the virus. But if you actually look back, by being cautious, it allowed us to, and locking down early and then reopening slowly and cautiously, that allowed us to be in a better position to recover and stay open and recover economically than most other provinces. So we're still, there's a lot of pressure to do things right now for tourism, but we say if we go too fast, then we run the real risk of having to lock down again. And every conversation I've had, no matter what business sector, ultimately what they come back to is says we have to avoid another lockdown if at all possible. So it's, again, slow and steady I firmly believe is still the way forward.
So looking ahead for some tourism, Dr. Strang, what do you see on the horizon as what's going to happen with people that are looking to travel, say, into the U.S. or across the ocean? How am I going to be able to prove that I've gotten both of my shots? Is it something that's going to be tied into passport control, or is the print off from the email that I get after I have my shots going to be sufficient for this?
Yeah, I mean, there's a lot of discussions nationally and even internationally around, how do you create a standard of what would actually constitute a valid and reliable proof of vaccination. And that's really talking about how do you do that kind of electronically. And so we're probably a number of months away before we do that. In the meantime, Nova Scotians can get their proof of vaccination. If you're vaccinated here in Nova Scotia, you can get I just got my second dose of vaccine today, and I got an email and I printed off my piece of paper. Soon we'll be able to, we're working on getting that so we can actually, if people have the Can Immunize app, we're using Can Immunize technology to enter all that information at the clinics. We're working on people can upload that onto their phone in the Can Immunize app. But right now, you can print off your piece of paper, and if as we go down the road, you might be able to have that proof electronically. And that certainly is going to be, I predict, the way of the future, especially around international travel, is countries looking for some proof of vaccination. And as I said, what's been worked on is having a certain standard, so countries are all looking for the same thing, and we can trust if somebody's coming into Canada from another country, we can trust the reliability of whatever they're bringing to prove their vaccination, and vice versa.
So with the variants that are showing their faces at this point in time, are we good on the vaccination? Are we anticipating that maybe something's going to creep in there that might require a bit of a booster shot?
So that's yet to be determined. We know that the current vaccines with 2 doses provide good protection against the variants, but I have to emphasize the 2 doses. We don't know yet, whether there's going to be another variant or even with the current variants, what is the long-term immunity that the current vaccines provide. They give good protection, but we need more time to follow the clinical trials. Every month we get another, another chunk, a month's worth of data showing, well, how long the people who are in the clinical trials, how long did their immunity last? And it seems to be the immunity is holding. But that's one of the questions of evolving science that I talked about earlier. Are we going to at some point need a booster dose? Either because the immunity that you've got is waning, or the virus has changed and we need to create another booster, kind of like we do with flu, because it's now a distant cousin, and we need to the protection you have from the first cousin, the initial one, doesn't work so well against this new cousin. So it's either that waning immunity or changing in the virus, which creates the need for another booster. We don't know that for sure. So yeah, while we're close to moving into the phase of living with COVID, but there's still going to be lots of work that has to be done to figure out what is our long-term future and what roles the things like vaccination are they going to play. Do we need to get a booster every year, every couple of years? We don't know that yet.
I want to ask you about the pressures on mental health that COVID and all the fallout has caused. Obviously, the mental health resources in Nova Scotia are under a great strain, as are all health resources and many other departments. But do you feel, Dr. Strang, that we still have adequate resources dedicated to mental health with all that pressure and strain?
So I think there's certainly a need for ongoing attention to the mental health, not just from COVID. Certainly, COVID has exacerbated. We know that for sure. Stress, anxiety, depression, because of fear and concerns of the virus, or many people are struggling with economic issues, etc., from isolation. So there's no doubt it's exacerbated mental health and substance use issues that need attention. Those issues certainly were here before COVID and needed attention. So there's still ongoing work to do in the healthcare system. Historically, we have not, and this is not at all unique to Nova Scotia, we have not paid enough attention to mental health and substance use addiction issues as we had with people with physical illness like diabetes or cancer. So we're slowly, adding some profile and adding investment in those areas, but there's still lots more work to do.
June was Men's Health Month, and it could be a bit of a generalization here, but being a man and having many friends who are men, I think we are a bit more reluctant to deal with our health issues and symptoms than women. But what about COVID? What are the gender splits looking like for vaccinations and testing? Or are you at that stage yet?
Yeah, well, a couple of things. We're seeing, I haven't seen any kind of gender breakdown on kind of mental health, substance use issues. I have no doubt that they're there, but I think as a general, we need, there's been an increase in the need for mental health addiction supports regardless of gender. We do know, however, that and this is again not unique to Nova Scotia, as we talk about vaccination, our seniors have done a great job and very, very high levels of vaccine coverage. But what we're starting to see it's the younger males, sort of 18 to 30, 35, who are, and again, we're seeing this across the country and beyond. They're the group that have the least likely to come out and get vaccinated. And there's always been this issue with young men who think we're invincible. At that time in life, we don't need health care. We don't, nothing's going to hurt us, kind of thing. We have some work to do with young males, and we're doing that in terms of very focused kind of social media pieces. We're working with a number of employers, especially employers who are predominantly young males. So right now we're talking on Monday, June the 28th. We actually have a little cluster of cases amongst fishermen up in Cape Breton. I was talking to the public health team today. Most of them are young men, and many of them they don't believe COVID is really an issue. And I think we're seeing in many of the more blue, if I can use the term, blue collar type workplaces, where predominantly men, that we have some work to do engaging with their employers and bringing vaccine right to the work sites. So we're working, for instance, with Michelin as an example about how do we bring vaccine right into the work site and make it as easy as possible. And if we can really, work with the employer to get their those young men immunized, and maybe then as they do that, then more of their friends and they can be role models for the rest of the community. And we're seeing it more of an issue, quite frankly, in rural Nova Scotia than in the Halifax area. Again, a lot of it is the more blue-collar type jobs. So we have some work to do. But if anybody's listening that is, maybe on the fence about getting vaccinated, it's important that you get vaccinated, not just for yourself. If you're young, there is some risk of getting severe disease, certainly not as much as if you're older. But I think we've done a really good job in Nova Scotia, by and large, of people saying, I'm going to do what I need to do related to COVID, whether it's staying home, whether it's wearing a mask, because I understand that I need to do that to keep each other safe. It's the same for vaccination. Don't do it just for yourself. Think about everybody. Think about your parents, your grandparents. Maybe you have a niece or a nephew who's got an underlying health condition, that they're more at risk from COVID. What about people in your community? So again, my appeal is that people are saying, well, do I really need to get vaccinated? It's more than just about you. It's about your whole community and your family, and you're doing it for them.
So, Dr. Strang, I'm going to paint a scenario and then see whether or not we can sort through what the answer might be. And that, let's say I'm a New Brunswicker or a Nova Scotian, and I've got a summer property in the other province. So I've got one shot, and then I go and I go on holiday. Is it possible to get my second shot in the other province, even though I've got it in the first province?
We certainly do have, and we've confirmed what we call transferability. So if for some reason you're in another province, or somebody from, let's say, from Alberta is here now in Nova Scotia, they can we're going to vaccinate them. Not people that are here visiting for the short term, but if we have students coming here or somebody's here for a job, we'll make sure they get vaccinated, because if they're here beyond just a couple of weeks vacation, well, then they become part of our Nova Scotia population, and we want them to be protected.
So would they go online and just make an appointment, or how does that work?
They'd have to phone the 1833 line, because we don't have to book online, you need a Nova Scotia health card. So to phone the vaccine line, 1-833-797-7772. So if you're from out of province and you're here for an extended period of time because of work, maybe you're here you come every summer and you're still looking for your second dose of vaccine, or you're working here for a period of time, we consider you a Nova Scotian, and we want you to be protected as well. But what we don't want is people here, well, I'm here for 2 weeks on holiday, can I get vaccinated? We don't have the capacity for that. And other provinces wouldn't do the same. But if you're a Nova Scotian who's going to be a student at a university out west somewhere, and you're come fall, you're still looking for your second dose of vaccine, well, you'll be able to get it there as well.
Perfect. I appreciate you answering that.
Dr. Strang, just finally, on a bit of a personal note, you are a very reluctant media star, that's for sure, and a Habs fan, I understand. We won't hold that against you. But I wanted to ask you, everybody needs a break. I can't imagine the hours that you and your staff are putting in. You have a family, and so how do you look after yourself, physically and mentally, health-wise? And are you going to get a break this summer, maybe a staycation here in our beautiful province?
Yeah, I've actually looked. I've got a week toward the end of July and a week at the end of August, and I'm hoping that once I get into fall and things are really stable, I can take a longer period of time away. But I'm not going to do that. I work with lots of people. They're all have the same, working just as hard. So I'm going to make sure they get their vacations before I kind of time off. Yeah, there's no doubt it's been a long go of it. It's been very long. I've been working seven days a week for the better part of a year and a half, and it has been wearing on me. But I get my family's very supportive. My wife, folks may or may not know I have a child with significant special needs. My wife's had to carry a much bigger burden of caring for my son at home, and I thank her for that. But we've got lots of support from our community, our church community, and local community for my family. And I get emails, letters, gifts and stuff from across the province, all of which I thank people for, because those are the level of support is really encouraging and strengthening to me to have that, to know that the work that I'm doing is people are paying attention and doing what they can as well, but also they're acknowledging and appreciating that.
Well, Dr. Strang, we thank you so much, and all your staff for the hard work, and we know it's not over yet, and a very special thanks from Quinn and I for your valuable time. We appreciate it so much, Doctor.
It's been a pleasure. Thanks to both of you, and hope you both stay safe, and hope you guys get some rest this summer as well too. It's been hard for all of Nova Scotia.
Indeed, for sure. Thank you.
Thank you, Doctor. We've been speaking with Dr. Robert Strang. He is the Chief Medical Officer of Health for the province of Nova Scotia. I'm Gary Nickerson.
And I'm Quinn Taggart.
And you've been listening to Outside My Window.